guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question. We're not going to touch it.
So we have heard that many times from the president. House Republicans have passed a budget blueprint that includes a plan to slash $880 billion over a decade from federal health and energy programs generally. While President Trump insists Medicaid won't be touched, experts say those kind of cuts really can't happen without cutting Social Security, Medicare, and Medicaid.
We should make sure that we are spending that money wisely. But Medicaid, this program that they are attacking with nearly $1 trillion in cuts, is one of the most efficient and effective healthcare insurance delivery programs, right? The fraud isn't there.
So we're going to have to wait and see how it all comes together, but some say this could be dire for Nevadans who rely on Medicaid coverage because they can't afford private medical insurance.
While others like State Senate Minority Leader Dr. Robin Titus say nothing is definite. Laura Lagarde joins us now from the newsroom with new perspective.
Yeah, Marie, people who carry Medicaid are scared, especially those in our most vulnerable communities. And that also includes people who are in that elderly community. While they do carry Medicare, they can also carry Medicaid for long-term care and also for their prescription medication. Now, this comes after the House voted in favor of their proposed budget that raised eyebrows from some Democratic lawmakers in Nevada who say this could lead to $300,000 being dropped by Medicaid. Those in our elderly community who are low income seniors who need health care, long-term care, or prescription medication could be on Medicaid. Hospice Care president spoke to us and she did express her worry. She wrote to us, and I'm just going to go onto my screen just so I can read you exact quote. She said, in quote, it really is a vital service for those at their most vulnerable in our community. She later on continued to say, I think there needs to be more of a look into how this impacts people state by state. Now, I also did speak to Dr. Robin Titus, who is the state Senate Minority Leader. She said, we're not kicking anybody off right now. Nobody is going to lose their Social Security. Nobody is going to lose their Medicare. Medicaid adjustments will be happening on basic eligibility. Now, this also comes as we did look at a meeting that went into this effect. As I did describe, there are Democratic lawmakers who are raising those eyebrows, and we also had some other local organizations who went in and talked about it. They talked about nursing facilities. As I did express before, it is that long-term care that they are really concerned about when it comes to Medicaid, especially when it comes to the elderly. Now, this has only been a proposed budget that has been passed by the House. It still needs to go through the Senate, but we will be giving you those updates as we get more information and as soon as that vote comes in. For now, reporting live from the newsroom, I'm Laura Lagarde, News 3.
All right, Laura, thank you for that. And even with all those assurances, there's so much uncertainty, as you point out. It's easy to understand why people are worried about this. Appreciate the update tonight.
All right, coming up on News 3.